special guest today is Dr. Sauer. I know him as a geriatric doctor, but he has other titles. So tell us what those are, sir.
So I am boarded in family medicine with boards also in geriatrics and palliative medicine, which is a newer, more emerging field of medicine that is gaining more popularity in the U.S. right now.
I have to tell you, he and I had a phone conversation and my mind was spinning because I realized that there is a lot of understanding that goes into diagnosis symptoms of Alzheimer's dementia.
Anytime you're going to have a conversation about a subject, especially a subject as important as Alzheimer's disease, you really got to get the terms down first to be sure that you're communicating effectively, not only with your family, but with the healthcare system itself. The term dementia is really thrown out there and used in a whole lot of different ways, and it makes people confused on what it is. Dementia itself is a syndrome or a constellation of symptoms which cause a person to have an impact on their life. So we can talk about behavioral symptoms, psychological symptoms, neurologic symptoms, and memory symptoms when we talk about dementia itself. I like to give a better comparison and say, if I went into the hospital and said, well, I have cough and a fever, my diagnosis when I leave should not be cough and fever. There should be an explanation as to what caused that. Did I have pneumonia? Did I have COVID? What did I have that caused that? When people say that someone has dementia, that refers to just those symptoms. And then it is imperative that we find out what the diagnosis is. What is the process that is causing those symptoms? And that's where we actually name the disease, like Alzheimer's dementia or Alzheimer's disease, vascular dementia, frontotemporal dementia, Lewy body dementia. A lot of people think, well, dementia is it's just all of them, but they're unique, they're different, and it's really important both to help patients and families to differentiate which illness you actually have, because they have different pathways and different symptoms. There's different needs for preparation, and it's important because people have a lot of important decisions to make.
I always end these conversations by reminding everyone that the Alzheimer's Association has a 24/7 helpline. Please write that down, use it. They will handle any question or need that you have. So please, so you are not feeling alone.
That's really valuable information. Actually, I hadn't heard, Thiva, of Lewy body dementia until your father was diagnosed with it, and you shared that information with us. So yeah, I didn't know that there were a lot of different terms, and it's interesting to see exactly what those mean.
Yeah, so helpful because Dad's was an aggressive. It had so many different, like he said, symptoms and effects to his treatment and how we interacted with him. I mean, he definitely, as you well know, had to have 24. He could not fix a bowl of cereal, right? Mm-hmm. Mom has Alzheimer's. She can fix a bowl of cereal right now. But Dad's was, and he also had the symptoms that were so physical, like the Parkinson-like symptoms. So yes, it's so important to have an understanding of what you're dealing with so that you can, as he said, plan for caretaking and how to approach each patient. It's just so key. Mm-hmm. I'm grateful that I knew.
Yeah, there's so much more to learn. You know, my husband's grandparents, one had dementia, the other had Alzheimer's, and I just kind of grouped them all together. I just thought a lot of it had to do with their memory, you know, mm-hmm. and they got confused a lot. But it's interesting to see that there's so much more to know. And as we get older, our parents get older, these are things that we need to be aware of so we can know if something doesn't seem right, that maybe that is a symptom of one of these, you know, either Alzheimer's or dementia. And there's even more to know after that too. I mean, it's just, there's a lot to it.
Yeah.
Yeah,
it's going to be more important for the caretaker, actually.
Mm-hmm. That's so interesting.
To understand.
Well, I'm so glad you're sharing that with us.
So that they are not beating their head up against the wall.
Yeah, I'm glad that you share that with us, and you do such a good job of sharing this information, but also with your mom. I know she's so lucky to have you, Theba. All right, we'll talk to you later.